I'm Ruth Boumphrey. I'm the Chief Executive of Lloyd's Register Foundation. This is my first time at a PEROSH event, and I'm very grateful for the opportunity to present some of our work here today. The nice thing about being at the end of the day is you get to hear everything else that went on during the day. The bad thing about being at the end of the day is you think, oh, I bought the wrong slides. Everyone's interested in different things. So I'm just going to test this out on you. But what I do want to say is that our foundation has been in operation for about 11 years. We've spent over £400 million in research, which I think nearly all of it will be relevant to this audience. So we have lots to offer you. The talk today I've called Feeling Safe and Being Safe. And the reason I've done that is because I'm taking two different data approaches, very different data approaches to safety. And they're very contrasting. And I'll explain why I'm doing that as I go along. So, the Lloyd's Register Foundation, this is our approach, our basic strategy, and that is that we have our vision, which is to engineer a safer world. So we're very much around sort of engineering and taking things from science into practice. So if you think of engineering is the application of science, how do you scale the science that you're all producing to put it into standards and regulation and into assets in order to scale that safety? That's what engineering a safer world is about. And our approach then is, number one, to establish the best evidence and insight. Number two, to focus on the most pressing safety challenges around the world. And three, to build global coalitions. And as PEROSH is an organization all about coalitions, I think you'll recognize this kind of approach. So my first example is in our evidence work. And it is all about, it's a collaboration we have with Gallup, who some of you may have heard of, on their world poll. So we have commissioned them and work in partnership with them on something called the World Risk Poll. All the data from this poll is available freely, and it's on our website, and I'll give you some QR codes later if you want to play with it. It's all available at a country level, so you can go and find your own country and compare how your country compares to everyone else in the world. And the reason we do this is we're asking three different things. We're asking people, individual people, about their perceptions of risk. We're asking them about their experiences of harm. And we're also asking them about who do they trust to help them be safe. Right? So those three things are important if you want to have an effective impact on people's safety. And the reason, why do we ask people how they feel about safety? And this is a really important thing because we serve society, all of us here serve society. And it's people's feelings and people's understanding of their own safety, which is a very important factor if you want to make a change in their lives. So let's put the people first and in the center of this. So in the World Risk Poll, there's hundreds of questions, and I have here, if anyone's interested, I've got a listing of all the questions from all the 3 years that we've done it so far. So if anyone wants to take some of those away, I've got some of those. There are dozens of themes and modules. The ones which I've pulled out today, which I thought would be most interesting to this audience, are the ones around occupational safety and health. In 2019, we asked people about workplace harm and reporting harm. In 2021, so 2019, of course, before COVID as well. 2021, the first polling after COVID, we also asked people about violence and harassment at work, which is something that we were interested in following the first poll. And the poll which is out in the field right now is about workplace harm as well, and about safety training. We're asking people about their if they've received safety training. And here I asked my colleagues to put these slides together for me. We have a typical worker from Northern Asia with his camels. So this is a classic occupational health and safety issue in that part of the world. So what I've done in this, I'm going to do a quick canter through some data from a European angle, because I thought we were going to have mostly Europeans in the room. You may not be interested in how the rest of the world feels about safety, but you should be, because this is all our supply chains, this is where people are coming from into our workforces, so you might find some really interesting insight if you dip into this data yourself. So first big thing, when we did this in 2019, when you ask people to provide data on occupational health and safety globally, there are massive holes in the map. And the reason that we did this, of course, we went into 142 countries, representing about 98% of the world's population, in order to try and colour in that map. And what did we find when we asked the question about injury? We found that 19% of people have been seriously injured while working, which is 1 in 5 people, which is a lot of people. So if we look at I'm going to throw up some data and things, maps here. So here's a sort of map of where in the world percentage have been seriously injured while working. You can see Sierra Leone, the Gambia, very high-risk countries to be working in, and the bottom 3. And this is all, of course, people's reporting. This is what people tell us. It's not collected in a different way. And then also we've got some data there about women versus men, and the classic, we can see from that it's mostly agricultural workers where the highest incidences of harm occur, which is quite well known. So looking at this next slide, and the take home from this is, we asked people, this is in 2021, we asked people to rank what they're most afraid of, what their greatest risks are, and then in a separate part of the poll, we asked them, okay, what have they experienced? And workplace harm is the only one of the risks we asked them about where the harm is greater than the worry. So most people worry more than they get affected by something, crime or bad weather or whatever. But for workplace safety, people aren't worried about it. And yet, 19% of people have been seriously injured at work. So it's something to be worried about a lot more. Interestingly, and here in Europe, you can see Europeans are especially not worried. So I think the second one down, and then, where are we, in the middle? Only 6% of people from Northern and Western Europe said that they were worried about being harmed at work. So that's quite a challenge for this room, actually, because if you're not worried, if no one's worried, if the politicians aren't worried, then how do you get your funding for your work? So these are the kind of things that you need to be working on, I think. So just a couple more graphs which I find interesting. So the first graph on the left-hand side is just a correlation around where people felt free to report safety problems. Okay, so nicely up at the top right-hand corner, you'll find most of the European countries, people feel free to report safety problems. And that's correlated against the UL safety index. And you can see down there in Pakistan, people are very afraid to report safety problems. Very interesting. And then on the right-hand side of the graph, excluding trips and falls, we asked them what were their perceived safety risks, top perceived safety risks. And look at their Europe in purple there. The highest perceived safety risk for Europeans is violence and harassment at work, right? So that is what is being reported by people when you ask them, rather than by your safety forms that you collect, okay? So if we then dig down even more, there's a typo on this slide. On the right-hand side, it's actually our 2021 poll. On the left-hand side, 2019, we said, have you been seriously injured? And that's the results. The next time round, building on thinking about harm and violence and harassment, we said, have you been harmed? We used a different kind of set of wording. And you can see the results kind of shoot up there. When people think about harm and think about injury, they think about different things. But these should all be thought about in the same sort of way. So some food for thought there. And then when we talked about reporting harm at work, are you free to report any safety problems you notice your employer without fear of punishment? Higher results for Europe compared to the rest of the world. Still not near 100% for either. A couple of other things that might be useful to people in this room. Other than yourself, who do you feel is responsible for your safety? And there on the left-hand side, while you're working, most Europeans say your employer. My employer is responsible for my safety, which is quite a bit higher than the global average, who believe other people like the government should be responsible for their safety. And then a sentiment question about, do you think safety rules are a good thing? Is that a good thing? And again, you've got quite a high percentage, again, of Europeans compared to the rest of the world who think that safety regulations are a good thing. Now, again, you might think, well, what's the use of this kind of data? If you're a politician or if you're trying to ask for increased funding in your area, some people think health and safety is a boring thing or a thing which isn't useful, but actually the data here is showing that the average worker thinks that this is a good thing. We need to have this, so it should be backed up. There's population level support for occupational health and safety interventions. So just takeaways there then, that 1 in 5 people have been injured, a large proportion see in Europe see themselves as responsible for their safety, and a clear majority see workplace safety as a good thing. So moving on quickly then, looking at mental health, okay? So we've had a few talks this morning about mental health. Between 2019 and 2021, there was a 5 percentage point increase in those experiencing serious harm from their mental health, which isn't surprising given we know in the middle of that there was a COVID epidemic, and we heard lots of interesting talks this morning about mental health and harm and the way people were experiencing their workplaces. So this is just the quick results from there. Have you or someone you personally know experienced serious harm from mental health in the past 2 years? And you can see that sort of uptick between 2019 and 2021, both in Europe and the rest of the world, with Europeans, reporting greater mental health harm than other parts of the world. So that's the takeaway there. Questions that you might want to ask is, what role does the workplace play in mental health, and how can employees mitigate that? So the next bit, I just wanted to talk about some of our collaboration. So when we started this poll, it's quite expensive to do polling like this, and we didn't have any customers for the poll. As soon as we got the first set of results through, we had all the UN agencies were like, oh, this is really interesting. We haven't looked at this kind of data before. And so we've now got many different collaborations with the UN agencies. UNDRR is part of the World Bank, and the World Bank is using our resilience data to help target where to make interventions now in case of disasters. But I'm going to talk about one particular collaboration we have, which is with the ILO, and the ILO were very interested in that data about violence and harassment. So we ran some special modules with the International Labour Organization on violence and harassment. So 21% of workers have experienced violence and harassment. And when you ask the question, have you ever experienced physical, psychological, sexual violence and or harassment at work, these are the results you get in Europe and the global average. The polling is not complete in this area because in some cultures it's not allowed to ask such questions. So I just wanted to say there's always these problems in polling around cultural interpretations. We published 2 reports on that. One is an ILO report and one is a foundation report, all available freely on our website. And you can look at your own country's data again, compared to the rest of the world. There's some very interesting, by the way, in this data, some very interesting data around Scandinavia, around Scandinavian women and their experience of violence and harassment in the workplace. So I'll let you explore that yourselves. There could be lots of different reasons for that. Then if you split by sex, that women are reporting more violence and harassment in the workplace. And then we also looked at it across income. So we thought, right, well, let's see if violence and harassment is experienced more by poor people than rich people, but no, it's actually experienced in quite a flat way across all income spectrums. So it's not something that just happens to poor people, it also happens to rich people. Then we went to ask people, do you tell people about your experience? So, did you tell anyone about the violence and harassment you experienced at work? Europe 56, global average 52, not so much difference there. And then it said, if you told somebody, who did you tell? Now, I think this is really interesting, that in Europe, only 46% of people told their employers compared to 53% of the rest of the world. So there's something about trust there. There's something about this, yeah. And who else did you tell? Well, not surprisingly, friends and family is pretty high on that. So, I'm not looking to interpret this data. You need to take that away and do it for your own companies, your own countries, and your own circumstances. But there are some interesting things to step out to me here. And then, if you didn't tell anyone else, why not? Well, look, on the left-hand side, 55% of people globally, including Europe, just said it would be a waste of time, right? So what is happening that people just think that they should suck it up with violence and harassment at work? And if we look at the right, is that a translatable phrase, suck it up? Well, basically put up with it. Should you just put up with the violence and harassment at work? And if you look at the right-hand side of this graph, I find this really interesting, is Europe compared to the rest of the world, some people are worried that people at work would find out. 40% the rest of the world are worried that people would find out that they had been harassed at work. And the fear of their own reputation is up there at 45%. So this sort of victim blaming thing, I think what I'm seeing here is that Europe is maybe having a better conversation about victim blaming, but maybe in the rest of the world, you still want to keep it quiet if you've been harassed at work, because you see it as a source of shame rather than as a problem that needs to be dealt with. So there's some very interesting data in these data sets. Again, freely available, do have a play. So that's the sort of summary there, and I'm going to just crack on here so I can get to the rest of my talk. In the field this year, so right now people are going out and asking people all across the world a set of questions again. These are the safety at work kind of questions that we have at the moment. We're asking again, have you experienced serious harm from the work you do, just to keep that trend going, because we think it's important to have longitudinal data on this. We're going to ask again, did you tell someone about that experience, to see if there's more openness now, about talking to people. And we're asking an additional question about, have you received workplace health and training and safety training? So that will be a data set, a unique data set that will come out globally. And then that can be all coupled with and analyzed against demographic information about sectors and subnational location data and all sorts of that. So if PEROSH would like, or if anyone here would like to have early access to that data, or would like to try, if anyone's doing this kind of thing in their field of research, we'd be very happy to look at putting reports together, looking at doing launches. The foundation has funding available to support any local interpretations or any work that you need doing on that. I meant to say at the beginning, the foundation is a grant giver, so we have a small grant scheme which provides sort of tens of K of funding quite easily, especially if you're working across national boundaries to help people come in from elsewhere. We also have a special pot of money to do with the World Risk Poll, where we invite people to submit applications for what they want to do with this data and how it will, create less harm. So. And we have a fourth round of questioning in 2025. So again, if PEROSH, if amongst your membership, if you think, well, the most useful question for us would be this, then we're happy to look at putting that into the poll in 2025. So if you see value in this data and you want to use it, or you want to try and steer it in some way, then we're very happy to have a discussion around what extra questions you might want to put in there. So that's, and I threw this one in as well. I'm glad I did, because you talked about AI quite a lot today. This isn't an occupational health and safety question. It's about your perceptions of AI. So one of the questions we asked was, do you think that artificial intelligence will be mostly helpful or mostly harmful, into your safety, right? And you can see the greenish countries are all saying, oh, it's going to be really helpful. So you can see where there's a big load of trust in artificial intelligence. And the redder countries it's going to really hurt us. It's going to be really harmful. Again, why do we care about that? Well, if you're trying to implement an AI-based solution, or if you want to bring AI into the workplace, then you're going to have to work with your public opinion about whether or not they see it as a positive thing. So there's that kind of data in the poll as well that you might be interested in. And I'm just going to keep that up for a few seconds. So the World Risk Poll site is on the left. That's a QR code for it. The Data Explorer is on the right. And you go for it. I am going to try and, I can see you coming, and I've still got half my talk, so. All right, now I'm going to get over to, so this is a program that Andrew knows a lot more about than me, and happily he is here for the whole of the conference to talk to. So this is the opposite end of that data spectrum, which is actual evidence data. So I'll come into it. So Andrew's got some leaflets about this with him. So if you're interested in this program, Andrew has some leaflets. And the major message here is we invite you to join this program if you're interested. So if you're interested in this program, please do join us. And Andrew is the point person on that. So essentially, Discovering Safety is a £10 million research program funded by the foundation. We have many collaborators in this. It's about data-driven. It's a data-driven program. The thing that stands out to me is that of the 40 contributing collaborators, we have lots of industry collaborations who are contributing their data and contributing their time into this program, which to me tells me it's a good thing to do, because industry wants to use it and industry is willing to contribute their data to make this work. So that is a big step forward for a regulator like the Health and Safety Executive to get that level of trust. So the Health and Safety Executive have over 50 years of data, and of course it comes in, it's very different from that World Risk Poll data. You know, it doesn't come in like that. It comes in because people have had accidents, there's been incidents, there's been prosecutions, there's been investigations. And there's a whole heap of data that comes into the Health and Safety Executive for lots of different reasons. But because it has to come in, because it's a regulator, because the regulator is doing its job. And then the regulatory operations use that data. But over in Andrew's science division, they have to do lessons from that. So what is the data telling them? How does the data help inform and improve practice? So the idea is from this program that we'll use the data to profile new risks, understand compliance challenges, give insights into accidents and prevention, and support the industry in making their regulatory responsibilities. So that's the background to this, all of this data and what Health and Safety Executive want to do with it. The program itself is moving from is trying to shift the dial from saying what has happened, reporting accidents, to what could happen, what might happen, and how do we prevent it? And that's extra complexity, but extra added value as well. So that's where the program is moving. And there's 3 parts to the program. One is insights from data, from new analytical techniques. The second is technology and innovation. And the third is creating solutions that industry can actually use. So I'm just going to race through this. The first one is insights from data. Essentially, the first step on the top left is to warehouse the data. So this is an AI-type program, okay? So we're warehousing all that data. We're getting it into a single place. The second part, which underneath it, which is unlocking the data by data anonymization, because essentially the regulator can't just share the data, it has to anonymize it, and that's a very big job to do by hand, so it can't be done by hand. So instead we have an artificial intelligence solution provided by Ohalu, which developed it in partnership with the Health and Safety Executive to remove all identifying characteristics from that data so it can be anonymized. Then the third part is creating new search and retrieve tools which are especially tailored to health and safety wording, to health and safety language, to linguistics around health and safety. So that's a sort of the part of the insights from data. What do we hope to do with those data? Well, we hope to digitally enhance the hierarchy of controls. So you're familiar with the hierarchy of controls concept, but by digital enhancement, you can actually get a lot of value as you move up towards things like digital twins and process simulations, where you're actually having safety by design at that point. You're building safety into the way that you actually create new workplace environments. This is just an example one that, of the new technology and innovation. So you can use technology and innovation to gather new data. So illustrations of inspections and audits, and the way you can use different devices in order to gather new data. We've heard lots of that today. And the second one is an example of technology innovation is using mobile apps to deliver digital and dynamic risk advice. So some of the nice innovative things that they've been trying to do with this program is, for example, in a small builder, for example, a young person, some of the insights that come out from this data are used in this. So one of the insights is that it's the under 25s using power tools are a huge source of accidents in the construction industry. So, and a young person doesn't want to sort of read through a manual, and do a risk assessment. So instead, we're getting young people to take a picture of the site with their phone, and that picture is used to then generate some tailored risk assessment to that person before they start their job, just to help them focus on the right kind of things. So that's an example there. And the bit that I'm very keen on is solutions for industry. So entering the last part of this, what are the solutions for industry? Now, HSE are very modest. I think this is quite amazing, the uptake of some of these tools. So on the left-hand side, we've been working heavily with the construction industry, and there are major national projects and regulatory bodies in the UK who are now using this and who want to use this tool for their new national infrastructures. So they're building it into, before they even start the process, they're building this new insight into the BIM models for construction. In addition, there's some other examples here, a framework of leading indicators that industry is using, a severity scanner, which is scanning sort of large data sets to see which are the most severe and most reportable issues happening. And down in the right-hand corner, I know it's something that Andrew's been closely involved in, is a partnership with Safety Tech Accelerator, which is bringing new and innovative solutions in and testing those. And I haven't been part of that, so Andrew, I welcome any words at the end that you want to say about that. So just the plea here is to get involved with this program. If you'd like to be involved, there's a picture of Andrew. There's Andrew in the flesh. Yeah, and there's many different aspects to this data. And finally, just before I finish, I want to tell you about something new the Foundation is about to do and invite you again if you want to be part of this. So we're about to establish what we call a Global Evidence Centre for Safety in partnership with RAND Europe. This follows what in the UK we call a what works approach. So essentially looking at the evidence of what interventions work, what do we know, and what interventions work, and where there are persistent gaps. So we're supporting the world's first dedicated safety evidence centre, and we think that this is something that the safety community could really use and also lean into. So we're supporting it initially with sort of 10 years worth of funding, but we think this will be a long-term centre that we're going to use. So that's it from me. I want to say thank you very much for inviting me, for letting me run over a little bit. And my cards are here, and I've also brought some copies of one of our foresight pieces. We do a lot of think tank work, and this is about the future of regulatory systems, which you, again, safety regulation systems, you may find that interesting. I've bought a few copies of that, so that's me. Thank you very much.